Our today's topic is cephalosporins. Pronunciation: cephalosporin. Learn the 5 generations of cephalosporin in one carousel. Learn in just 3 minutes. Try this before start. Do you think the followings about cephalosporin are true? The later the generation. The broader the spectrum of activities, the later the generation. The less adverse effects will it cause. What to learn: 5 generations, drug example. Spectrum of activities, pharmacokinetics, key nursing notes, too long, didn't read. First generation, drug, Cefalothin, Cefazolin. Spectrum, most gram-positive kochi including penicillinase producing, Staphylococcus. Second generation, drug, Cefuroxime, Cefoxitin, Cefotetan. Spectrum, less active against Staphylococcus but greater activities against gram-negative bacilli. Third generation, drug, Cefotaxime, Ceftriaxone. Spectrum, broad spectrum with gram-positive, gram-negative, and anaerobe activities, but less active against most gram-positive when compared to first generation. Third generation and Pseudomonas, drug, Ceftazidime. Spectrum, extra spectrum of activities covering Pseudomonas aeruginosa. Fourth generation, drug, Cefepime. Spectrum, similar activities as third generation with Pseudomonas coverage. Also active against some Ceftazidime-resistant isolates, 5th generation. Drug, Ceftaroline. Spectrum, extra activities against MRSA. And vancomycin intermediate, Staphylococcus aureus visa. Pharmacokinetics. Most parenteral cephalosporins except Cefazolin and Ceftriaxone have short serum half-life and should be administered at every 4 hours. All of the cephalosporins, except Ceftriaxone, require dose modification in the presence of severe renal failure. First and second generation has poor cerebrospinal fluid penetration ability and should not be used to treat central nervous system infection. Key nursing notes: avoid alcohol to prevent a disulfiram reaction. Monitor for signs of rash and superinfection, overgrowth on tongue, vaginal itching or discharge, loose or foul-smelling stool. Take with food, refrigerate suspension, discard any drug after 14 days. Complete the full course of the medication, even if you feel better. Too long, didn't read? Cephalosporin is a commonly used beta-lactam drug for treating infection. There are 5 generations available, and they have very different spectrum of activities and clinical uses. Most cephalosporins require renal adjustment. Avoid alcohol while on cephalosporin. Monitor for signs of rash and superinfection.
Thanks for your time and support. Stay connected with us for more interesting pharmacology studies.